And warm welcome to one and all who has joined Gyan Pravah, which means the Flow of Knowledge podcast series, episode 16. Here on your screen, you can see two most beautiful women who have a lot in common. Both are full of energy and have an infectious smile. Both are very spiritual and both follow their respective gurus. And coincidentally, both ashrams are near Pune. Both instantly connect with the person they meet and remember their first name. Both believe that a good leader is one who creates more leaders and not followers. I, Dr. Manoj, Chairperson Medical Disorders in Pregnancy Committee Fogsi, and host of today's podcast, welcome our guest speaker, none other than Madam Vrinda Bhatt, who is Celebrity Wellness and Energy Healing Coach. Welcome, Vrindaji, to my first podcast and also first podcast of my committee. It will be a pleasure to travel this journey of holistic wellness for mothers to be, which is the topic of today's podcast. Before I give detailed introduction of my guest, let me welcome and introduce Dr. Sunita Tandulwadkar, Madam, who is a dynamic president of Federation of Obstetrics and Gynecological Society of India, known as Fogsi, a professional body of 46,000 gynecologists. You can say she is Prime Minister of Fogsi for year 2025 and we are 30 cabinet ministers. She has the IVF unit and OBGYN unit of Ruby Health Clinic, Pune. She is not only renowned infertility specialist and endoscopic surgeon, but she was president of Endoscopic Society called IAG, and she is president-elect of Infertility Society, ISAR. She is also the founder and director of Soul Clinic IVF, which is Center of Excellence in Infertility. She is also the co-founder and medical director of Stem Cell Research and Application Center. That's really incredible. It will really help women all over the world. She has not only founded this research center, but she has this extraordinary achievement of delivering India's first stem cell baby at the age of 45, which has earned her place in medical history. Hearty congratulations, madam. It's really a proud moment for India. She is also founder, president of Ovarian Rejuvenation. And this too is the need of the hour. Congratulations, madam, for this great initiative. Madam has received many awards, and I'm sure she must have lost track of them and must have stopped counting them. To mention a few is the Bharat Gaurav Puraskar, Glory of India, and also received letter of appreciation from President of India. She is an avid reader, great academician too. She has authored 18 books, over 85 publications. She is editor-in-chief of Indian Journal of Gynecological Endoscopy. She has attended more than 400 national and international conferences as faculty and delivered various orations and keynote addresses. Madam, thanks a lot for giving all chairpersons this unique opportunity and platform to host this podcast. May I request our beloved President, Dr. Sunita Tandulwadkar, Madam, who is a visionary, iron lady, path breaker, a pioneer, an inventor, innovator, a great leader, who has conceived this idea of podcast and has guided us to implement this project. Madam, I invite you to deliver welcome address.
Thank you so much, Manoj. Thank you for your kind and graciously used words. Thank you so much, dear. So friends who are watching this podcast, I'm sure Foxian and even the common public is there in this podcast series because we are putting it all across all the social media. Now, what was the intention of this podcast is Fogsi, our organization. It works in a very different way. It's a very beautiful organization which has completed 75 successful years. So automatically, every president has worked very hard to bring the organization to the level which it is today. And I probably may be fortunate because I got the organization which is very well disciplined, very well functioning. So apart from the president and the 5 vice president, the other people who work in my team with the academics is the 30 committee chairperson. Now, these 30 committee chairperson are the leaders of tomorrow. They are leaders of Fogsi for tomorrow. what was my aim during the presidency is not to have just the webinars over webinar, which we are saturated in last 4 years. I thought these people, all the 30 committee chairpersons of mine, they are bubbly, they are enthusiastic, they are creative, they are intelligent, and they want to do something different. They just needed someone to give them a direction and a permission. And believe me, this is the most happy moment of my presidency. This is a Gyan Pravah series. Every chairperson works so hard to get the best of the faculty. It's not necessarily the academic. It may be a spiritual, it may be a politician, it may be a philosopher. And today we have I'm saying you Dr. Vrinda because after talking to you, I felt you are a doctorate in a mental health. You are really the true healing guide. And friends, I just had 5 minutes conversation with her, but I felt like I know her very well because the connect which happened in these 5 minutes, the click which happened, probably sometimes for 10 days you are together and you may not be clicked with each other. And maybe you are there with each other for 5 minutes and you felt like our energy is sinking. We are together on this path. And if 5 minutes, such an amazing conversation if I have, I'm sure in 30 to 45 minutes of a podcast, Manoj will bring the best out from Vrunda. Not only that, I was calling you Vrunda, I should be calling her Vrunda Ji. Because
you can call me what you like.
Her accomplishments are so huge. When Manoj shared the CV with me, I felt very delighted. I am always in search of a like-minded spiritual person who understand why we are on this earth, why we have taken a birth, and what is the karma we are going to do so that we take it back with us. Manoj, I need to thank you. And this is what my purpose was. Every committee chairperson, they come out with the brilliant idea. And every podcast is better than what the previous one. So if you are hearing Manoj on 16th, every month on 16th, you will be getting to hear Manoj. So this is how the podcast picture is. 30 chairperson have been given 30 days of the month. And whichever month we have 31st, probably it is me who will come out with one of the session of spirituality in medicine. Thank you, Manoj and Rundaji. It is wonderful talking to you. And I will be joining you from the delegate link once Manoj gives your introduction.
Thank you, ma'am.
Thank you so much, Dr. Sunita.
It's a great honor and privilege for me to introduce guest speaker Vrinda Bhatt Madam. She is a holistic wellness and energy healing coach who completely believes in the power of human mind and its power to co-create with existence to maintain a life of one's dream and truly be happy. She believes we all need to understand ourselves as a human energy system, which includes the physical body, the pranic body, mental, emotional body, subconscious and supraconscious sheaths. When you understand yourself as vibrant energy being and you have the knowledge of how to integrate and use this energy, then you are empowered to create the life of your dreams. The biggest drain of this vital energy is excessive stress and anxiety. Vrinda Madam has been a personal fitness and wellness coach for a score of Bollywood stars like Amitabh Bachchan, whom she has been coaching for the past 24 years, Mrs. Jaya Bachchan, Mr. Amir Khan, Karan Johar, Kajol, Jacqueline Fernandez, Ms. Sushmita Sen, Madhuri Dixit, Leigh Sridevi, who was her first celebrity client, Abhishek Bachchan, Farah Khan, Tina Ambani, Tabu, Arjun Kapoor, Dimple Kabadia, and Twinkle Khanna. And I'm so proud to say that she is my coach too. I have done the course of Empower Your Energy under her guidance. I feel a lot of change within myself. There was anxiety, there was a lot of issues, which like when with this course, I've really changed a lot. Along with her husband, Shivoham, she conducts holistic fitness workshops throughout the country and online to promote fitness of body and mind. She was the mental fitness expert for the pageant Mrs. India World 2019. So welcome, Rinda Madam.
Thank you so much, Dr. Manoj, for having me. Thank you so much, Dr. Sunita, for having me, giving me this tremendous opportunity to get the truth of life across to as many people as possible.
Thank you. Thank you. And as we discussed, we'll definitely have you more with our organization because we want the babies to be born to be heard by you.
Oh, thank you. Thank you. So I can't tell you what that means. They will, this is something very beautiful happening already. I can sense it. This was set in motion 2 years ago, and I know exact moment who I was sitting with when I said it. And today, both of you are fulfilling that dream.
Thank you. Thank you.
So much.
All the best to you, Manoj, and I'll listen to you.
Thank you.
Thank you.
Thank you.
So, Vrinda ma'am, like as a gynecologist, when a pregnant woman comes to us, we do everything. We see her blood pressure, we see her blood sugar, and when she complains of vomiting and all, we give her drugs and we tell her everything. What when she has to come for the sonography, when she has to come for the injections and everything, what medicine she has to take. She has to take iron, calcium, folic acid. But you are talking about the holistic health. So, what exactly it is and what else should be done?
It is very important, Dr. Manoj, to understand the entire human system. Human system is not just the body, because everything that you mentioned is about the physical body. There are physical parameters that you check, but there is also mental, emotional body. So when you talk about the physical body, it is called the Annamaya Kosh. In the yogic system, it is given for centuries and centuries ago. And it is very important to bring this knowledge, this understanding of your own self, of your client back. And it's very important to bring this knowledge back of your own self and your patient so that you can treat the patient in a holistic manner as well. So when you are addressing the physical body, which is the Annamaya Kosh, you're advising on all that needs to be done at that level, then subtler than that is the Pranamaya Kosh, where the chakras are there, the nadis are there, where the flow of energy is there, and this energy flow is going to be working for all the major energy systems. Subtler than that comes your Manomaya Kosh, where your thoughts and your emotions are there. And all of these are affecting each other. So whatever is going on in your mind will affect the pranic flow, which will affect the physical body. And whatever is happening to the physical body will again affect the pran. And that again will affect the mental emotional body. Subtler than that is your Vijnanamaya Kosh, which is your subconscious body, then the supraconscious body, and the subtlest is your Anandamaya Kosh, which is your soul and your spirit. So every person needs to understand themselves in this totality, because just at the face of it, everything, all the parameters might be fine. But when your patient is coming and sitting in front of you, you have to even ask, how are you feeling? Are you feeling good? Just your smile can make a light up that. I feel for a patient, the doctor, whether it's a gynecologist or a GP or a specialist, they are like gods in that moment, because they're going to help them charter a terrain which they have never traveled before. So just a smile from the doctor is going to really lighten and soothe their nerves. And asking, how are you feeling? Feeling not physical symptoms, mentally, emotionally, how are you feeling? So it is very, very important, I feel. Today, again, science has proven so much that our state of mind, whatever is going on in your mind, your thoughts, your emotions are affecting every cell of your body to some level or the other. Stress hormones themselves have such a big role to play in every aspect of your functioning, pregnancy included. So knowing how to manage the mind aspect, physically, yes, we are taking care of it as it is. But the mental emotional aspect, there was a very big gap for that. So there has to be a prep for a mother. A mother has to have proper protocols to follow, even for the mental emotional health. Just like the physical, you tell them, okay, have this, have this, have this. Even for the mental emotional body, there has to be a protocol. This is what I call holistic wellness, because you're not just the physical body. You have subtler layers of who you are, which we call sheaths, and they need to be addressed as well. And of course, spirituality is a massive aspect of everything around us. So, body, mind, and spirit have to be addressed in totality.
Thank you, ma'am. And what happens when she comes to us speaks, she is very anxious. She's worried about the future, what will happen, and sometimes if she had abortions previously, then she is always worried. She thinks about the past, and she's worried, will it happen again? So how she can control her thoughts? Her self thoughts are very negative. Always she's talking to herself. Everyone, we talk to ourselves in our mind. So, how to take care of the self talk? How important is the self talk?
Self-talk is everything. It's actually everything because you are talking to yourself the most. People think they talk to their father the most, the mother the most, the husband the most, brother, sister. No, it's us. We talk to ourselves the most. And like you rightly said, most of it is negative. I'm not good enough. What if I can't do this? What if this happens? What if that happens? So when I do my own webinars and I teach people to take charge of this self-talk, which it is absolutely fundamental for your overall well-being. Not just the self-talk, there are proper practices to be put into place. This self-talk has to become positive when you are mindful and you change the negative words for the positive ones. When you're talking about fear, it is about the future, which has not happened yet. Anxiety is about the future. What if things happen this way? And they are thinking of a very negative scenario. But at that moment, that scenario is only in their head, correct? Now, if it is in their head, they have the chance to think what they like. But they are compulsively going towards a negative pattern of thinking, which I call the negativity bias, which they have developed due to just the habitual conditioning that they've had. Most of us are conditioned to thinking negative in every single situation. The work that I'm doing is making people understand the importance of developing a positive mindset and then working towards it. You need practices. Everything has to be encoded with practice. You can listen to this podcast, you can feel really nice, you can know the importance of what it is saying, but if you do not put it into practice, it is not going to happen. So I would recommend that even when a patient is coming to you for consultation before they get pregnant also, I'm sure that happens. At that time itself, they should start working on their mental well-being, physical well-being and mental well-being. They have to already start eating a nutritious diet, physically exercising regularly, and the same principle applies to the mind. Their mental diet has to be nutritious. The thoughts that they are ingesting from outside in the form of content, it has to be nutritious, it has to be uplifting, it has to be productive, progressive. Again, mental exercises have to be there, which are called affirmations, which are called flipping a negative thought, which you have learned with me, which I call the 3-2-1 flip technique. A negative thought is stuck, and which, in fact, this is given by Maharishi Patanjali. Not the 3-2-1 pattern, but he called this Pratipaksha Bhavana. It is very important that we understand that we have control over what is going on inside our mind, because a lot of people are confused and they've said, man, we can't control what we are thinking. But you absolutely are. You can control what you think with practice. So these practices are put in place so that each time a negative thought comes, you can snap your finger and change it to a positive one. This is, again, it has to be learned and it has to be practiced, and over time it can be done. So before, like you asked me this question, like before they come to you after they're pregnant, when they're only consulting you, at that time only, I feel every gynecologist should advise their patients, please take care of your mental well-being. These are the protocols, these are practices. A lot of coaches out there. I am making coaches as well. You are one of them. Other gynecologists can become coaches themselves. They can have coaches working under them, with them, in synergy with them. And the one person who benefits, two people who benefit the most, actually can't limit it to two, but the people who benefit the most are you yourself, the mother, to be the child, the mother's family, everybody benefits because you resolve one life. And the ripple effect of that is felt by everyone around, especially the baby. So when you mention the negative thought, I'm sure every mother knows today that whatever she's thinking, whatever she's feeling is already encoding the mind of a child. It's affecting the health of the baby. It's affecting the mental, emotional framework of the child already. This is given in the Mahabharata, the story of Abhimanyu. So in our ancient scriptures, this wisdom was already there. And I'm so glad that the modern medical world has also done enough research to prove this, that a child is impressionable in the womb, very impressionable. So it becomes all the more important for the mother to be ready in every which way before she gets pregnant. So next time when she will come to you, Dr. Manoj, after she's pregnant, you would ask her, so how are you feeling? She will say, oh, I have ups and downs, but I can manage it. I take care of it. This is the response I get from when I am working with mothers before they get pregnant, during their pregnancy, and post pregnancy. I speak to them, how are you doing? Everything is going fine. Yes, I had little mood swing, but I can manage it. I have the tools that you gave me and I can manage it. So I'm at ease. And you can see that filtering, Dr. Manoj, even into the lives of the husband, the child, the in-laws, the whole unit, because it's about energy. Energy is not just me, energy is also all the people around me. So when one entity, and that energy being the mother, when she's so positively charged, it flows to her baby, unborn baby in the womb. While after the baby is born, the practices still continue. It flows to her husband, and I always insist that the husbands have to be part of the pregnancy. The couple gets pregnant. It's not only the mother who's getting pregnant, the mother is doing extra work by carrying the baby as well, but the father is equally involved. So when I coach people, they enroll as couples. And they both do their practices, they both work on their own mental well-being. There are practices to be followed. Every day morning practices are there. We will talk about them in a bit. Whatever I can share over here, I would love to share over here. And they follow that protocol. And then by the end of the practice, they collectively give the energy to the womb. The child, I feel, I don't know if any research has been done on this, I feel that the child would be able to sense the energy of the father's hand on the belly and the mother's hand on the belly. A child, because there's no language at that point of time, it picks energy. It can really, really sense energy. That's what I intuitively feel. I hope some research has happened and they've proven this also. But when the father's hand and the mother's hand is on the belly, a very beautiful energy, especially when they both have working on their own cells, a very beautiful, powerful, charged energy goes to the child as well. So yes, this was my answer for what you asked.
And you've gone beyond that. You started this the course from bride to be. So before she becomes a bride, you are training them, and this also helps in this thing. So what is this training about, and what exactly you do in this training?
So this training is about self-discovery. Self-discovery in the sense that the only part of ourselves that we know is just what we can see, what we can process with the five senses, which is the physical body. But educating people that you have subtler levels of your own existence and how you can take care of all of those. So it starts with understanding yourself in terms of energy. You have to understand that you are a human energy system, because unless you do this, you will not be able to create anything in life. Child is a God's grace. But besides carrying a healthy pregnancy and delivering a healthy baby, even if you have any other goals, whatever goals there might be of good health, of yourself, your child, happy relationships, money, career, whatever it is, it requires energy. So first is understanding. My endeavor is to make every human being, billions of people on this planet, need to have this fundamental literally knowledge that you are an energy system, and whatever you want in life, it will require energy exchange. So whether it is about conceiving a child, it requires energy to conceive, a healthy amount of good energy to conceive that baby and to carry it to full term and then deliver and then raise a healthy life. It requires energy. If you want money, relationships, all of that will require energy. So it starts with how to build up this energy. My course, which is on manifestation, is called Heal Your Energy. And people used to ask me initially, ma'am, why are you calling it Heal Your Energy? I said, because the whole play is about energy or urja. It's a very beautiful word, Dr. Manoj, urja. And how you can supplement this urja, and this is not only to be done by mothers to be, even when they are girls and they are navigating through life, trying to find a partner, even trying, using bride to be, of course, a bride to be is also going through her stresses. Kaise in-laws honge? What is going to happen? What is new life going to be? The family is going to change. So when she starts working on her energy systems, and then she starts understanding and doing the practices, how to increase this energy is one, how to clean this energy every day, because we are interacting with so many different people, different kind of energies are interacting with us. So we need to clean this energy as well. And how to block the unnecessary drains that are happening of this energy. And the biggest drain of this energy is your excessive stress, excessive anxiety, the self-doubt, the low self-image. All of these are like ceaselessly draining. The never-ending comparison we have. I still remember this happened, the building I was living in earlier. So there was a beautiful young mother, and this was the time when I was doing my program, which is called Matri Shakti, which I just spoke to you about, where I just had this need for women to understand their power in resolving their own health and the health of the newborn baby. So this mother came to me really stressed. She's like, Vrinda, I'm really worried because my child is not walking yet. I said, did the doctor say there's any problem? So she said, no, the doctor's saying it's absolutely normal. I said, then why are you worrying? She said, no, because all the other children in the park that I go, all the other children are walking. So this comparison, this ceaseless and meaningless comparison is draining the prana of the entity, of the physical being, of the human being. And this drained prana is having an effect on the child's life as well. So this FOMO, this fear of missing out, all of these practices, all of these things, issues which are coming in this new age world, all of these I'm addressing in my course, and which is very important. So people understand what they can do about it. There was no need to worry. And the child is walking today and perfectly fine. But in that moment, who is going to be the support system? Doctors is saying, nothing is wrong with your child. The child is fine. But she's comparing in her mind, my child is not walking. What is wrong with my baby? Oh my God, he's not looking so good in front of other babies. So all of that starts, Dr. Manoj, with the confidence that the woman has in herself. And that is developed, the self-image that she has. The self-image of divinity, that we all are potentially divine. We are sparks of divinity itself. So when we start, it's a process. Bit by bit, we go deeper into our self-identification. Who are we getting identified with? Because if the identification is going to be only to the body is going to change during pregnancy. And
So
like how?
she's more worried about her body, what people will say. So I think
Yes,
self-validation is very important, and one should not compare with others. One should consider that I'm the best. I'm the best.
best, best का concept, best तो आएगा जब comparison होगा. So best is a concept when somebody is not as good. I'm amazing. So this is the simple practice which I would really like to share. I do it in my courses and webinars. Simply, when you wake up in the morning and you look in the bathroom mirror, usually our faces are very, very sad and very blah. So what you are supposed to do is look at yourself, look at one of your eyeballs and tell yourself you're amazing. And why are you amazing? Because you're alive. You're alive. You have life still throbbing in your veins. You're amazing. I'm amazing. I really believe that I'm amazing, and then so are you, and then so are the almost 8 billion people on the planet. So having this kind of a mindset and developing this, and how do you get to believe? Because people ask me, ma'am, we can say it, but we don't end up believing it. How do we end up believing anything, Dr. Manoj? By repetition. We say it often enough for the right reasons without comparing ourselves to others, because we are all unique expressions of life. Absolutely unique. There is no other Dr. Manoj just like you on this planet. There is no other Vrinda like me on this planet. One unique piece we are. So we are our unique expressions, and how can we compare? We are living our own karmic paths. How can we compare? So bringing this mindset, bringing some spiritual understanding of life, and then putting protocols into place, putting practices into place. Just by reading a book about good nutrition, just by reading a book on exercising regularly is not going to actually give you the nutrition and give you the benefits of exercise. You have to eat it. You have to eat the good food. You have to do the right kind of exercise. I'm talking about physical body. Same way is for the mental, emotional body. Same way is for the spirit as well. So all three need to be addressed one baby step at a time. So that the mother to be does not get overwhelmed, I would recommend start as early as you can. Start in your teenagers, because there's so much of confusion even today on relationships. What kind of the physical relationship that the young girl is going to have in future? Who is going to ease that anxiety away? So this is my whole purpose, is to tell human lives what their potential is. And then empower.
Where one should start the day? Are there any practices we should start in the morning so that we are full of energy and very positive throughout the day? Anything we should?
Of course, Dr. Manoj, a beautiful question. Always know, firstly, we need to know what builds up our energy and what depletes our energy. So whenever we are in gratitude, shukr, I already have so much, your energy will build up. Whenever you're having positive thoughts, your energy will build up. Whenever you're having negative thoughts, you're always finding, oh, this is not there, this is not there, this is not there, your energy is getting depleted. This is the way energy works. So every morning when you wake up, just check. Breath is moving, life is good. Thank you. So you fold your hands and you bow down and you genuinely say a thank you to whatever this energy is, who we call God, we call Ishwar, we call Khuda, whoever this energy is. I call her Mama. She's the divine mother for me. And thanking that energy, saying thank you for blessing me with life today. Today is a good day. Thank you. So that gratitude always begins with the gratitude for life itself, because it is not a small thing. It is a big deal to be alive, and every gynecologist would know this. When they give birth, when they are assisting in a birth of another human life, Dr. Manoj, you would have known that joy. I feel gynecologist, every gynecologist would actually feel the same joy as the mother, at least close to the mother. If my God, a life has come. So how can we not know the value of life? And this is not being ingrained into us. Every other value has been established, but for the value of life. This is the reason why suicide cases are skyrocketing. For any ups and downs in life, people are thinking, oh, life has no meaning. No, life is the purpose. So saying gratitude for that seems very simple, but it is very powerful. Then another practice I can share is connect with the sun. That is the life force that is running our entire system, and especially for the mood swings that a pregnant lady has, even post-pregnancy, all the mood swings. Connect with the sun on a regular basis. Do your breath works and pranayams on a regular basis. Do your affirmations on a regular basis. Take care of yourself on a regular basis. All of those ups and downs and upheavals that happen depending on the hormones, you will be able to manage it. All our mothers went through it. Nobody, I don't think 40, 50 years ago, people spoke so much about postpartum. I'm not very, it's your field, so you might know better. It happened to everyone. It would happen. But how they move through it, you can improve. You can really learn the skills and you can navigate through that. So connecting with the sun is very, very important to actually balance the hormones and reduce the symptoms of depression. Connecting with the earth is another one. So earthing is very, very important. So I would not say only for during pregnancy or post-pregnancy, for life. So before you get pregnant, only make that habit of connecting with the sun, connecting with the earth, doing your breathwork and pranayams, like I said, visualizing that it's going to be a beautiful pregnancy. The child is going to be amazing, talking positive to the child. Even visualizing your relationship with your husband, it is a beautiful one. Both of us are involved. Like I was sharing with you before, I believe a couple gets pregnant. It is not only the mother. I feel a family gets pregnant if they are living in a joint family. So this kind of an education has to be given, has to be done, and not just education, practices, which the family does together. I have done this, Dr. Manoj, with couples, and you see the kind of child they deliver. You would imagine a young baby sleeping at 10 p.m., barely wakes up at night, wakes up at the timing that the parents are waking up at 5:30 and 6, all three of them doing pranam to the sun, even when the baby is an infant. The mother and the father both sit and do their breath works, their visualizations, they write their affirmations together, and the baby is in the mother's lap. Can you imagine the energy that gets created in this system? What a beautiful, what a grace. With that energy system, you're already changing the life of the baby to so many notches higher. Creating that positive energy, you're healing your life also. The mother is healing her life. The dynamics of the husband-wife, which can get strained during pregnancy, they get joined back. They don't drift during pregnancy. That's not supposed to happen. They're supposed to be together in this. And that is, I think, one of the biggest something that makes women really sad, that men get busy with their lives and they are left with the baby. And they go through all the hardships. But what if the husband, he goes to work, he comes home, and even the mother would be going to work, and they come home, and the first thing he asks, how are you feeling? Give a hug, hold her hand, talk to the baby. But the mother needs the attention as well. And one very important factor, which I've noticed because I do a lot of couples, a relationship work as well, I notice that after the baby is born, everything is about the baby. Baby is a center of attention for everybody, and the mother feels neglected. So her confidence, which was already so low, goes even further low. Because the husband comes, he goes straight for the baby. Everywhere, relationship, all the relationships, they're going straight for the baby, and she's sitting in one corner, feeling the need to be loved, feeling the need to be appreciated. So this is also what I resolve. I train women to really, in a practice of self-love. They will learn how to love their own being. They will learn how to appreciate and validate their own being. And with that mindset, something very beautiful happens, Dr. Manoj, that they won't need that much of mollycoddling from outside, but they still get it. But they will get it more because they attract it.
That is very important, because then the surrounding won't affect her. Self-validation, as you said, is very, very important. And if she's positive, then all surroundings, other people start getting affected. And one thing I would like to discuss, like we as a gynecologist, we are always stressful. There are a lot to be done. Family has to be taken care of. If you are running a hospital, there are so many issues. So I think these things, first we should empower ourselves. First we should change ourselves, then we can impart the knowledge, or we can take care of the patient. So what's your take on this?
Of course, Dr. Manoj, somebody really wise said this. Become the change that you want to see in the world. This was Mahatma Gandhi. So every gynecologist is also a human system. So every single gynecologist or anybody, businessman, politician, artist, whoever you are, if you're a human being, what I'm saying is applicable to you. So when you wake up in the morning, you will do the same practices. You will be grateful for your life. So this increases your own energy. You will connect with the sun, you will connect with the earth, you will connect with the 5 elements in a certain way. When you drink water, it is drunk with reverence. Thank you for nourishing body, mind, and soul. When you eat food, it's with the same reverence. So what any gynecologist, the moment you're touching a client, there's so much of energy exchange, and when you have multiples of clients throughout the day, you'll be very depleted by the end of the day. And you as a doctor have to keep your energies really vibrant. So these are the ways. Connect with the morning sun and the evening sun. Each time you drink water, say something positive and drink water. Let something nice and soothing keep playing in your consultation room, even in your hospital. Let something soothing, instrumental. You should know the frequencies that are there, which sound is everything, no, Dr. Manoj? Sound is everything. This is given in our scriptures. Nada adhina jagat sarvam. So sound, using the correct sounds, correct vibrations. Sound is vibration. We all are vibrations. We all are sound. Using the correct sound to uplift the energy. It could be chants, it could be classical music. That will also recharge you. And very important, I would recommend all the gynecologists or anybody who's listening, learn how to breathe right. Most of us have become like shallow breathers. Because usually with a stressful situation, stressful day, and gynecologists also have families. They also have to look after their own families and then their extended families, which are their clients, their patients. So it is so important that the demand of energy on them is probably 10x. So making sure that you supplement that energy, you again work on creating that energy with the practices I just shared, and breath work to reduce the unnecessary drain. The moment you're getting anxious, you should be able to pick it up. People are asking me, ma'am, how do we know we are getting anxious? I said, my God, that uneasy feeling is called anxiety. It can be excitement also, but both need to be settled. Both have to be settled. Because physically, anxiety and excitement feel the same. Butterflies in the stomach, racing heart rate, shortness of breath. But they both need to be settled because नींद तो दोनों cases में नहीं आएगी. So how do we settle it? Everyone needs to know. Maybe you've seen 10 patients and 11th one is coming in and you're tired. What are you supposed to do? Take 2 minutes out. You inhale from the nose and do diaphragmatic breathing. You will inhale from the nose. Make sure that the abdomen comes out slightly when you inhale, and you exhale longer from the mouth. You're literally decompressing your system. Let go of all of that stressful carbon dioxide. Inhale again and exhale longer. Let it go. Let go of all the stress. The stress is getting built up in your system as carbon dioxide. So release that carbon dioxide. Within 2 minutes, you will be charged. You will be charged and you will be ready for your next patient. But keep doing the practices. You've been through the whole program. So there are lots of practices that need to be done, which once you bring them into your daily life, it is not a big deal. It is as simple as brushing your teeth. Telling yourself you're amazing is as simple as brushing your teeth because you make a habit out of it.
I think lifestyle is also very important, though at times it's not possible for the obstetrician to follow it. But I think eating dinner early, sleeping on time, waking up early in the morning, and having a proper schedule, this also affects our thought process and this thing.
1001%, because we are completely wired into these beautiful celestial bodies that are around us. In fact, Surya Dev is our first Pratyaksha Dev. We are all running on the prana of the sun. The circadian rhythms, being in sync with the sun, is so important for every single human being. We are not nocturnal. So aligning ourselves with the sun, and of course I understand there can be deliveries happening at night and you can't wake up in the morning. Connect with the sun at least in the evening then. How long will it take? Take 2 minutes. Connect with the sun. You don't want to say a mantra. Just say, thank you for nourishing my body, mind and soul. Give me courage. Give me strength. Surya is for courage and strength. Prithvi is for the softness of life. Moon is for the softness of life. Surya is for the fire. So knowing what to ask from who is also very important. And these are alive entities. They are not just inanimate objects just rotating and revolving. No, they are alive beings. They are lofty beings. So you can use their pran. We are all solar powered. Whether we get the energy from the food that we eat or from the animals that we consume, energy is still coming from the sun. So the sun's energy, it gets converted into usable energy into a plant, and then the animal will eat the plant and we'll eat either the plant or the animal. So it's coming from the sun, so you can take it directly as well. So following the rhythms of the sun is very, very important. And sleep time. Have a sleep discipline as much as you can. Intend it. And even when you can't, I love your question, Dr. Manoj, that supposing you are even, you have to be at the hospital. Aapke paas probably you only have like a half an hour. Practice Yoga Nidra. It's a very conscious relaxation starting from the head right down to your toe. So at least you will be refreshed after 15-20 minutes. You can do, it's conscious relaxation. So practice Yoga Nidra. So there, once you look for solutions, you will find them. People say night duty, this, everything. You let me know the problem, I'll come up with a solution. But it's your job to apply the solution. So no complaining, only resolving and solving.
Thank you. Incredible advice. Thank you so much. So like we had already discussed when the women is in labor. So in the labor room also there should be some music, mantra should be there, a bhajan should be there, and husband should be by the side of the women when she is delivering. So I think that bonding, that thing is very, very important when she is delivering.
Of course, the chants that are there, and these are the chants which the mother has been listening to throughout her pregnancy. Because the baby also has to feel comfortable to come out into this new environment. And the touch of the father, which he has felt on the belly during pregnancy, even if the father is just holding the mother's hand, still the baby will feel the vibration. The baby will feel safe enough to come into this world. It would be so, we are talking about the mother and the father, it must be traumatic for the child also to come into and suddenly start breathing air for the first time. So making that entire, again, it's an ecosystem of energy. The more at ease the husband and wife will be, enough 1001% the husband should be with the wife. And it's not about, it depends sometimes. If that bond is not so close, Dr. Manoj, then maybe the wife says ki nahi, meri mummy ko bhej do, send my mother in, send maybe the mother-in-law goes in. But my personal opinion is the husband should go in, because half the child is the husband's. It's a genetic entanglement. So that husband should be there with the wife. So for this, husbands need to become very mature. They have to become very mature, and this maturation has to happen during the pregnancy, pre-pregnancy, when, even if it's an arranged marriage, pregnancy should be discussed. Yes, of course, there can be unplanned pregnancies as well, but there's still so much time. You have 9 months to come on the same ground, to understand how your lives are going to be changing and what you can do about it. Can you stop it from changing? Of course not. This is the change that's going to happen. But what can you do about it? That is what matters. And what parents can do about it is have an unbreakable, unshakable bond with each other. The child deserves it. And yes, having said that, at least put in the energy. And then future, nobody knows. Nobody knows. Nobody has guarantees of the future. But intention has to be that this is the bond being even made stronger by the presence of this child. Let's give our collective energies, not just physical, mental, emotional, spiritual, all the energies for the child. So coming back to your question, the father has to be present throughout. He was present during conception, then he has to be present during the entire term of the pregnancy and the bonding. Of course, you can't be 24/7 with each other, but that bonding has to be there, even in the delivery room and post that as well.
That's really a wonderful advice. And tomorrow is Valentine's Day, so I think all the husbands should really treat their wife in a nice way, and all the mothers. And I'm an infertility specialist, and I get the patients who are very anxious to conceive, who have been married since like 7 to 8 years. And they're so worried, especially if they are more worried about the people, what people are saying, and things like that. So, how to deal with this? What advice will give to those women?
So very beautiful question and much needed, because I feel, you are a doctor, so you can let me know this even better. I feel the level of stress and anxiety has an effect on if the woman will retain the pregnancy, if the woman is going to get the ovulation, if the entire reproductive system, not just the reproductive system, your digestion, your assimilation, your reproduction, elimination, all of this, your circulation, everything depends on your stress levels. Please correct me if I'm wrong.
Correct.
It is. Cortisol plays a very big role. Even if 30 years ago doctors did not believe it, but today there's a lot of medical evidence that you increase the possibilities of getting pregnant if your hormones are functioning fine. So for that, the mother, she's coming for an IVF treatment because the natural way of conceiving is not working. Am I correct with that? Yes. So bringing back the health, of course, the treatment is going on, but making sure that the treatment works well, you can do all the practices to de-stress you. Because if you're stressed out, the treatment, you reduce the chances of the treatment working. If the mother is so anxious all the time and fearful, nahi hoga, what if it doesn't happen this time? What if it doesn't happen this time? Because it has happened in the past that way, then in all probability, you are inviting that trouble. So I would recommend that every mother, whether you're going through natural pregnancy or IVF, you have to work on your mental well-being. You have to be able to visualize something positive. No matter if this time it did not happen, it can happen the next time. And in all probability, it might just happen the first time you tried. It might happen naturally. There are couples I know who did IVF for the first pregnancy, and the second delivery was normal, was natural conception. That is also cases like that have happened, and famous cases like that have happened. So your reproductive system and it's relaxed. Maybe a possibility is the first time you're so scared, it's not happening. Oh my God, it's not happening, and you needed IVF, and second time because you relaxed, kacha, one child is already there, so that little security is there, and it might happen naturally, or you can go through IVF. So, but your state of mind, this is what I want people to understand, whether it is in pregnancy or living your life or in achieving your dreams, whatever your dreams are, your state of mind controls your urja, your energy, very big, in a very, very big way. And your energy is what you need to create the life of your dreams, which includes a happy, healthy baby. So the doctors are doing their bit, the patients have to do their bit. And then God's grace. Three most important ingredients, I feel, in whatever your goals are. You need your own energy to be in a very good vibrational space. You need your doctor's energy to be in a very good vibrational space. And then you need God's grace. Because we can only do what we do, doctors can only do what they do. Then it is all in God's hands. Correct or not, Dr. Manoj? I think all doctors do believe in God.
Definitely.
Yes. So that synergy, knowing the role of all three, and each one doing their bit, then you see how God doesn't agree with. He will. As long as you do your karma, the gynecologist does their karma at the level of mind, body, and soul. The karma is done on subtler levels as well, which we discuss in the course. So, yes.
Thank you, Vrindaban. I'm really enjoying this conversation. I'm sure our audience are also enjoying. And I wish we can go on and on this topic. So at the end, how would you like to summarize our conversation and what message you would like to give to our audience?
My mission, as you are aware of, is to empower 5 million lives in the next 5 years. What this means is make everyone aware that this is your power and this is how you can integrate all of your energy, your urja, and then apply it in the direction of whatever you want in life and achieve it. So I would request each and every one of you who's listening to see this a few times, and when you get inspired, and start understanding yourself in totality so that you have the tools to live this life on your own terms. It should be a beautiful journey. Ups and downs to lage rahenge, but it should be a beautiful, fulfilling journey, and that's what I'm here to teach.
Thank you. Thank you so much, Vrindaban. It was really nice having you here. Thank you so much.
You so
Hope to see you on this platform again and again. Thank you so much.
I will be here each time you call me.
Thank you.
Thank you, Dr. Manoj. Thank you for having me.